Hi everyone, welcome back to the episode of Ask Dr. Nick. My name is Dr. Nick Schmidlkoffer and I work for the Neurologic Wellness Institute. And today's episode, we are going to answer the question, why is it beneficial to learn about pain? And especially your pain, or why you may be experiencing your symptoms, your painful symptoms. And this, I think, is one of my more favorite questions to answer or to talk to patients about, is about what causes pain first initially, and then what causes chronic pain. And it's really important because there are different areas in the nervous system, from the receptor, maybe like right on the tip of your finger, all the way through the nerves that attach to your spinal cord, and then from the spinal cord up into the brainstem and the rest of the brain, that all can initiate pain signals or give you the experience or perception of pain. Basically, if you get a paper cut on your finger, you don't experience pain until that signal of what's called nociception, or damage to your skin, those receptors. That signal gets all the way up your arm to your spinal cord and then up into your brain. So essentially, you cannot have pain without your brain. And so I want to talk about the importance of why learning about your pain can be beneficial for you, or if you are a clinician, for your patients. And so let's just go to this paper. It is from Physiotherapy Theory and Practice from 2016. It's called The Clinical Application of Teaching People About Their Pain. And so basically it's talking about pain neuroscience education, teaching people about the neurobiology, neurophysiology of their pain experience as a therapeutic effect, and has been referred to as pain neuroscience education. There are some other examples or other names for it as well. Increases the efficacy of pain neuroscience education in decreasing pain, disability, pain catastrophization, movement restrictions, and healthcare utilization. And so this article kind of talks about the systematic approach in how the exam, the education, the delivery of this education, and then movement goal setting for patients, and then the progression of it and how that can be beneficial for patients. And so pain is a really disabling experience. And so, but it's a normal human experience, and without the ability to experience pain, we would not be able to survive. It kind of tells us that something is wrong in our body. And so we need to experience pain. So there are multiple books. Butler and Mosley was one of the first ones, calling Explain Pain. It's a really good book, has a lot of great graphics. But I just want to talk about a few of the graphics in this paper. Sorry for the excessive scrolling. Nope, it's the next one. All right, so here I love this picture, this graphic. Okay, so if this is a metaphorical explanation of the nervous system as an alarm system telling us we need to do something. Basically, that we have pain, we need to fix it. Okay, so this here is person's body. It's the human nervous system. It's all the nerves in our body that are attached to every inch of skin, joint receptors, all those are joints, so on and so forth, and then going up into the brain. It doesn't really have the spinal cord. Oh, it has, yeah, it does. A little bit of the spinal cord there. And so, for instance, if we step on a nail, okay, we need to be alarmed. Our brain needs to be alarmed, because if we don't realize that we step on a nail, then that nail could be rusty, we could get infected, tetanus, those kind of things. Okay, so we need to be alarmed. We need to have pain, nociception. Our foot needs to tell our brain that there is damage in the foot. And so we step on it, we have this alarm activity that fires up to this firing level and says, hey, this is sensitive, we have pain. This is important. We need this mechanism. On the other hand, so now when the foot is starting to heal, so we take it, we heal it up, foot's starting to heal, so now that acute pain starts becoming kind of a subacute throbbing pain, and then it heals. What happens is this firing level is going to go down back to its normal excited level, this normal sensitivity level, okay? this is completely normal. Now, if this person is back out walking and, in the grass with no shoes on, also steps on a rock, they may be extra sensitive, right? Maybe it never came down to that lower normal excited level. Maybe it's just sitting right here in this mid-range. And also you step on a rock and you have this experience of like, oh no, like I stepped on a nail again. This, and it's extra sensitive. You have this like alarm system telling your brain like, uh-oh, we have to do this all over again. And so this is how pain initially can then lead to traumatic pain, chronic pain, or then maybe even a fear of pain or a fear of continual digress, or a fear of then walking barefoot, many things like that, fear of movement. If somebody, for instance, injured their knee and now they're afraid to move their knee because it has this extra, it's at this like higher sensitivity level, okay? So then let's go to a different picture. Okay, right here. So this is kind of what I was just talking about. So before pain, you have a normal excited level. So people have lots of room for activities. You can run, you can bike, you can walk around, you can do your typical activities of daily living. So go to work, shower, bathe, all these things. Lots of room for activities. Just get water out of the cabinet or make your own dinner. And again, all these room for activities without pain. So let's use, a hip, for example. You could, walk, run, all these things, no pain before you got the pain. Now, maybe if you, tweaked it or stretched it too much or did, a bunch of heavy squats, then that pain increased, okay? Now, after the pain, our normal excited level is here, but maybe we have this extra sensitivity. This is what leads to the chronic pain. So now we have this extra sensitivity of maybe the receptor, or more commonly within the brain, as in like the limbic system, the part of the emotional anger memory system, that can become sensitized. And now it's like, oh, last time I, hurt my hip doing this one activity, or I didn't feel like doing this one activity. Now every time I'm about to do that one activity, there's this extra sensitivity. All of a sudden it's like I start to do it and I get this firing from my limbic system that increases this pain perception. And so what's important is to basically increase this room for activities, is to slowly bring this extra sensitivity down to a normal excited level. And so showing patients, or if you're a patient yourself, understanding this is important, okay? It's not a straight, I'm gonna have pain and then I slowly decrease down with no like increase in pain ever. No, this is a curvy roller coaster line, okay? So getting the knowledge about this pain, that pain can come from the brain. Maybe the hip is completely healed. It's been over a year, the hip is completely healed, there's nothing wrong with it. But there's these extra sensors in the brain, this extra alarm system that's extra sensitive. And so understanding that, doing aerobic exercise, doing relaxation, meditation to lower that limbic system, lower that feeling of fear, diaphragmatic breathing to activate that vagus nerve, pacing, graded exposure, so slowly increasing activities of daily living, whether that be walking more, walking up the stairs, squatting, being able to take a bath on your own, all these things. Manual therapy can help to decrease the sensitization level. Other modalities, and of course, goal setting, finding a way in life, a thing that you want to get past, you want to get past this pain. Okay, so I really like this analogy of working slowly to get this sensitivity level in the brain, this alarm system in the brain, back down to its normal excited level, rather than being so high. And then last one, this is kind of how it works through time, is that this progression, as function increases, so as you start being able to do more things, pain also starts to decrease. It's kind of this dual curve. And it may go slow at first, but as function increases more, pain is going to decrease more. And so it might go faster once it gets going. Okay. And then, of course, we have these different, time or therapeutic neuroscience educations, right? So we have to understand that this is a roller coaster of pain. And so every time there's a flare up, it's about taking a step back and understanding this is just a flare up. There is no increase in damage to the tissue. It doesn't mean that we're going the wrong direction. It's just a flare up, and we bring it back down and continue working. And so it's just understanding that pain can come from the brain, and these little flare-ups don't necessarily cause tissue damage and does not mean that you're going the wrong direction. Okay, it doesn't set you back. So that's all for that paper. But I really just want to emphasize that pain is this perception that's produced from the brain for a big, important reason. It's to protect yourself. But sometimes it can do too much. It can lead to this chronic pain that we need to get over in order to do other activities of daily living, in order to live and thrive. And so understanding that you aren't a victim to your pain, understanding that you can get past your pain is really important. And so I really urge people to do some of these things that might have been on there, like breathing, meditation, goal setting, and to continually understand that as function increases and you start doing more, pain is going to also decrease. So I really hope you like this one. Like I said, I like talking about pain. I think everybody should understand where pain comes from, because that can help people get rid of their pain. And so if you have any questions or comments, please leave them below. If you have any suggestions for future topics, I would love to hear them. Thanks again, and have a great day. Stay healthy.